Welcome back, everyone, to Open Line. Glad you were with us. We're talking about the COVID-19 case surge that we are seeing in Tennessee and really all across the country. We have with us Dr. Milstone, pulmonologist at the Williamson County Medical Center, and Isaiah Whalum, a COVID-19 survivor, 46 years old, was in the hospital there for 53 days, but he's okay. I have some more questions for you, Isaiah, but I'm going to take a call here. Cindy's been waiting. Let's go to Cindy. Hello, Cindy.
Hi, good evening. I'm just listening to Isaiah's story, and I just want to say that we need to give God all praise for bringing you through, because had he not sent you to the right hospital to get the right treatment with the right doctor, you probably wouldn't be here. So hopefully you have given him all the praise. Now, the second thing I want to talk about is the fact that many people still don't believe COVID is serious. I was just at dinner with some people last Saturday, and several of them was like, oh, well, you know, these surgeries, they're not really real. We're just doing more testing, and that's why it looks like it's real. But I said, no, more people are getting it and more people are dying. Well, you know, it just seems like it's like that. And I'm just thinking, these people they're delusional. Well, you know, what's going to happen if thousands and millions of people are thinking that way around the country? When is this going to end? And also, what's going to happen to these poor little children if they go back to school? Because, I mean, if kids start dying and teachers start dying, all bets are going to be off, and this country is just going to be completely, it's going to just come loose at the seams. You see what I'm saying?
Oh, I do see what you're saying, yes.
How are we going to get people to start believing it's real? And that's my comment. Thank you.
Okay. I'll let both of you take that. We talked a little bit about it at the top of the show. Isaiah, what do you say to people again? Her question directly is, how do we get people to believe it's real? What do you say?
Well, first I would like to tell her that I definitely honor and thank God for his saving grace. But not only that, the people that prayed for me and all the energy just throughout the hospital, I know that there is a God. Again, I said the same thing, Ben. We can talk about all the conspiracy theories. We can put all, I get that. I certainly understand that. I am political in some things where I believe, but there comes a time you have to put that sword in the sand. This is the time to put the sword in the sand. This is a pandemic that's being fought. It's a silent killer. It's lurking in every possible area that it can, and it's going to take lives if people keep thinking, nobody should make me wear a mask, or a lot of the things that I'm hearing. I don't want to call it silly, because if you're passionate and you believe that, I understand. But let that govern you. You have to think about your neighbor, your children, your family, your co-workers. Everybody that's our neighbor deserves the right to live. And no one should be out here carelessly saying, I don't care. I'm going to just do whatever. Hey, that trip to the bar, you don't know if that's your last trip.
Right.
You don't know if that barbecue was that important. You just had to go to the mall.
Well, let me ask the doctor, because we're going to take a break here. Your response to that, she was at a dinner party, people saying, yeah, there's really nothing to this surge. And we talked about that briefly. Briefly, what do you say to that, doctor?
I mean, I think part of me thinks that it's kind of the ostrich in the hole in the sand, that we have something that threatens our livelihood. We have a lot of uncertainty. This is a complex time to be in this country, and we don't have a lot of control. And so there's plenty of research to show that people that are non-believers or support conspiracy theories, they're trying to make the dots connect when you shouldn't connect them. And that's what I say to that. These are people that are nervous. These are people that aren't certain what tomorrow brings. Will there be another shortage of food? Will there be more people in the ICU so that if you get sick, you can't get into that hospital? And when you have all this uncertainty, the brain tries to rationalize it. And maybe if I ignore it, maybe if I say it's just not there, it's not happening, it'll go away. But COVID-19 will not go away. COVID-19 is here to stay. And if we don't do something dramatic to fix the problem, this is going to be a huge, huge issue in our near future.
All right, we're going to take a break. And then I want to ask you, Isaiah, since you've gotten out of the hospital, how are you doing? Are there lasting, lingering health effects, mentally, physically, whatever? We'll take a break. Be back right after this.